So research takes place in different places in society, and some of the research needs taxpayers' money to make it happen. So we've always funded research at European level. Innovation union thinking is different because it says, let's take the research, partner with those who ultimately will use it, cities, regions, hospital managers, bring them in upstream, involve them in making sure it's the right research, it's the best outcome, and involve them also in delivering use more quickly than in the past. Innovation takes place everywhere, but if we want to test the new model, we really need to look at a specific case. Europe has chosen the specific case of active and healthy aging. We are all getting older. We are not getting older in best of health. So how can we drive more health into our lives? That's the principle. The newest aspect of the European Innovation Partnership for Active and Healthy Aging is partnership. We desperately need not just the people in white coats, not just the tech companies, but doctors and patients and hospital managers and mayors and regional leaders, all to be involved from day one, so that it's not just a piece of technology that stays on the shelf, but we actually design the best technology for use tomorrow and not for use next year. So the European Commission creates a space where those who care about something can achieve their goals better because they're working together across the whole of our continent for 500 million people. Whether you come from a big member state or a small one, partnering with people everywhere makes you do it better. And that's what the European Commission is there for. So I think the first thing that we have to ensure is that the older people in society, let's say 50 plus, are just as happy with the coming technologies, including the digital revolution, as their children and grandchildren are already. So getting everybody digital, everybody online, everybody happy with e-banking, for example, is crucial. Only then can we have digital health, because if you build a digital health model but old people don't know how to access it, it's worthless. So that's the key. I hope that the MedTech industry will be a major partner in the active and healthy aging process, not just in the sectors and for the products where they are already active, but helping to engage with this future-proof research and the deployment agenda that we hope to drive for better health for the older part of the population.
The Innovation Union is targeted almost entirely at dealing with this emerging problem of more and more ageing people in care. Technology is a key enabler of how you can help people to live active and healthy lives well into their old age. So examples of that would be allowing you to monitor patients in their own homes, allowing patients to treat themselves in many cases and gain high degrees of independence, rather than the traditional way, which is institutionalizing patients. Well, the Innovation Programme for Healthy and Active Aging is a major European initiative to try and add 2 healthy life years to every European citizen. Clearly, with an aging population, if everybody's sick and old, then the burden on the healthcare system is huge. If you can keep people active and healthy, then there's a profound difference. So we've got pretty heavy involvement. 2 of the steering committee are drawn from our network. Guy Lebeau, who's the chairman of Eucomed, and Sharon Higgins, who runs the Irish Medical Devices Association. We also put a large number of projects into the hopper, if you like, at the early stages of this project, ideas, if you like, to use. And a number of those have come through the process and form part of the major programs that are going to take place in the future.
The task force was very honoured to be invited to take part on the European Innovation Partnership on Active and Healthy Aging. This is a really important opportunity for the SME community within the medical devices and diagnostic sector to put their points of view across. Many of the issues that we identified within our report are what we would call horizontal issues. So these are issues around how the models work, how the whole framework conditions work for companies designing, developing, marketing their products across Europe. And we're delighted that because the European Commission has set up this partnership, it's given us a really good opportunity to identify these particular areas, and all of those have been put forward into the Commission through that, through Commissioners Daly and Kroes, who are responsible, and Maura Geoghegan-Quinn. And again, all of that information is now in the right place from our perspective, and we have opportunities now at a horizontal workshop, which is taking place quite shortly, to identify these areas again and to put case studies forward to show how the appropriate models will enable SMEs to develop and grow in Europe, which is what we ultimately all want to see. One of the things about SMEs across Europe currently is that they don't have as big a voice as they would like to have. So we believe this is a very important opportunity for them. In many cases, they're focused on their day-to-day job. They don't have time to make representations to the Commission or to their member states even in terms of how they need to grow. So they would see this as a very positive, and they would see, I believe, the Eucomed task force as a very strong opportunity for them to engage at an appropriate level and to get their story told.